So good morning, good afternoon, everyone. Welcome to this technical discussion on risk management plans and how crucial they are to minimize disruptions in the supply chain. We will start in a couple of minutes to give time to people to join us. So bear with us and we'll be back shortly. Thank you. In the meantime, the people who are already joining us, we're going to show a Menti question about where you are located, where are you joining us from. So feel free to scan the QR code or go to the Menti website that appears on the screen and use the code that you see on the screen, so we know where you're located. Yeah, I can see Chisulo is joining us from Zambia, Enrique from Congo. If you can, we will see on the map also where you're joining us from. And Lubna, so Lubna, I met you yesterday. Nice to have you joining us from Libya. Okay, if you could pin the map, Zambia, of course. Barbara from DC. Cho from Myanmar. Malak from Jordan. Great. Annabella from Guatemala. Yes. Hi. Matthias from Cameroon. Ahmad from Afghanistan, Abdul, Marco from El Salvador, welcome. Thank you for joining us. Imsa from Samak from Nigeria, okay. Ethiopia, Laos, Geneva, my goodness, great. Syria. Nigeria, Ukraine, wow, Somalia, Mali. Thank you so much for joining us from all over the world. So this shows the interest that you all have in this topic, and it's great to have such a variety of participants from different places. So this will be a very, I would say, rich discussion with our guest speaker. You all bring a lot of experiences and lessons learned that you will be able to share and to be able to ask questions to our guest speaker today. So thank you so much for joining us today. So today, with my colleague Annabella Sanchez, we will be facilitating this session. Annabella, welcome, and please introduce yourself.
Hi, thank you, Nora. Welcome, everybody. I am Annabella Sanchez. I live in Guatemala, and I have been working for JSI as a consultant supporting the Bureau for Humanitarian Assistance Capacity Building project. We have been doing capacity building with blended learning courses, and also supporting organizations directly to improve their policies. And So we are happy and excited about this important topic today. Welcome.
Thank you, Annabella. And my name is Nora Quesada. I'm a senior technical advisor at JSI, working in international development, supply chain management, and other areas of international development for many years now. I'm based in Bogota, Colombia, South America. And so I'm very happy to be here again with you all. And today we also are honored by having Aya Abdeljalil from Libya, and to have her sharing her experiences in humanitarian assistance. So Aya, welcome, and please introduce yourself.
Thank you, Nora and Annabella. I would like to extend my thanks to the JSI team. I really appreciate it to make this happen. So yes, I'm Aya, the pharmaceutical manager at IRC Libya Country Program. I've been working at IRC since 2019, and my main responsibility, including the medical stock management, including quality assurance responsibilities. It's between the supply chain and the program team, the health team, actually. We worked on the local pre-qualified supplier with the format during their project in Libya, representing the in-country focal person. Yes, thanks.
Thank you, Aya, and thank you again for accepting to be our guest speaker today on this important topic that I'm sure it will be of interest to all the participants who are joining us today. Thank you so much. Okay, so
thank you, Nora.
Of course, we have some housekeeping announcement, and so I'll pass it on to Annabella.
Great. Thank you, Nora. So as always in our education series meetings, we ask you to introduce yourselves. I know that you have been doing already, but those that are coming in now, please write your name and your organization. We will welcome you all. And on the other hand, at the end of our presentation, we will always have a Q&A session, and please make sure that you use the button on Q&A so that we don't miss. If you write them on the chat, it will be difficult for us to monitor your questions, and we don't want to miss any of them. So thank you. Before we start, we would like to acknowledge the support of the USAID Bureau for Humanitarian Assistance capacity building program. We, through this project, we are currently supporting humanitarian organizations through blended learning courses, also to conduct other pharmaceutical supply chain capacity building activities, in-person trainings, and learning sharing, which is one of the objectives of our sessions today. And also more directly to support partners to institutionalize the knowledge that you have acquired into their policies and procedures to improve supply chain management performance. Also, a very important reminder, we are almost to complete the 6 events education series, and we are only going to have one more before the year ends, and that will be in December. You will receive an invitation next week. So stay tuned, because the idea of this series was that if you attend 4 or more sessions, you will receive a participation certificate. Please stay tuned. And the session objectives of today are here on the screen. We will review strategic considerations when developing and implementing risk management plans. We are also going to share key threats, examples of key threats that may disrupt the supply chain operations and availability of many types of health supplies. And we will also learn approaches to managing different levels of risks to protect the availability of medicines in your organizations. And that is why we have invited Aya as well. Sorry, before we pass to the next slide, we are going to go back to Menti, and we will ask you to please answer this question. What are the benefits of a supply chain management plan for pharmaceuticals? So we invite you again to use the code and start popping in your ideas of what do you think are the benefits of a supply chain management plan? And while you do that, we would like to highlight that all the actions that are related to avoiding or minimizing risk are in a way a day-to-day activity. Some of the examples that we will present and that we will hear from Aya are actions that you regularly do. So please go ahead and use the Menti code, mitigate unforeseen events, yeah, reduce costs. That is one of the benefits that we think it's crucial. Ensure medicines availability, better forecasting. That's great, excellent. And avoid delays. The risk management plans help us to reduce the chances of not having the medicines in the right place at the right time when an emergency or a crisis arise. Efficient use of funds, absolutely. Unbroken treatment. Wow, yes, yes. If you have treatment guidelines, they can be interrupted if there are risks in the availability of products. Great. Those are very, very important ideas. Resilience versus adversity. That is very meaningful. Reduce loss, and also waste, right? Thank you for popping all these ideas, and we will review some other benefits from having this mind of avoiding risk as much as possible. Okay, so thank you very much for your inputs. We're going to go back to our presentation, and it is very important to mention that in the context of a supply chain, a risk really represents any threat or disruption, like you mentioned in these ideas, to the performance of the supply chain cycle that may also hinder the delivering of life-saving medicines. In a humanitarian response, particularly, minimizing risk is a matter of saving lives in a very ever-changing environment. So that is why this topic today is so crucial. Risk management is a formal approach to identifying in an organized manner and addressing sources of disruption, to identifying what type of risk might happen in the future that will affect the supply chain performance. We will briefly look at some of the key aspects to managing risk and minimizing disruptions to secure availability of health products. The key themes that we are going to briefly overview today, and with the help of Aya, we will also give on-the-ground experiences, will be to go over the benefits of supply chain management risk plans, also to the supply chain risk management process, the key steps to go through this organized process, the common threats, the more common threats that affect the supply chain management performance, and of course, solutions to common problems. And at the end, a few strategic considerations that we can think of, but of course, during the Q&A session, you might also share your strategic ideas as well. So talking about the benefits, these are only a few examples that complement what you already mentioned in the Menti question. I would only highlight that it helps to increase prevention and reduce firefighting. I know that sometimes our countries will be hit or will be suffering from very sudden, unexpected situations, and that will be always something that it is out of our control. But there are a set of circumstances that we can plan ahead of time and learn from previous situations like the COVID-19 pandemic, and start thinking more broadly on how to avoid those risks. Another benefit is a well-defined risk response protocols, and having a response protocol in a very orderly manner will be always very important to have. And this benefit at the end is having fewer disruptions, which mean fewer stockouts and less excess inventory and fewer expired products and waste. There are 4 steps, basic steps for managing a risk management process. The first one is a risk assessment, and that is a very detailed team approach activity that will define the context in which you are. Sometimes absolutely it will depend on the country and the context and the situations that usually arise in your day-to-day activities. And so managers should first determine the scope and context of their risk management efforts. Here you will identify and list all the possible risks, both that are within your control and those that you will need to accept and try to have a response protocol to handle the activity. Then risk planning, prioritize in order of levels of risk, how to manage this threat, and also to, after planning, to organize a set of indicators that might be already part of your supply chain monitoring plan to evaluate how things are happening on the ground and what other actions you need to take. And incident handling is a very important aspect of a successful risk management process, and it will require development of how to handle incidents. If you remember and you were part of the quality assurance process, handling recall of products, it is a very important step. So that is an example. Some of the common threats, and I'm pretty sure you may have many others, is for the supply chain is unexpected political unrest, natural disasters that have increased in the last years, lack of compliance by suppliers that might affect both the availability of products, but also the quality of the products, increase in freight costs. That is why some of you mentioned that, having a risk management plan help reduce and optimize costs. Increase in freight costs after the COVID-19 pandemic. Everyone knows that freight costs have increased tremendously. Delays in the importation process, that is a very common threat, right? And frequent changes in government regulations and theft. Some of the examples of the solutions, I will go through them quickly because Aya will share with you some of the actions that our IRC has done in Libya. So first of all, you need to have solutions for when you need to accept risk because there is no way that you can avoid it. Avoiding risk, for example, frequent breakdowns of vehicles, reducing risks, and hedging risks as well. Here, one of the activities or solutions that you may have is always include fire or flood insurance costs in your budget. You don't need, you cannot miss that part and justify it, especially if you're in a hurricane region or in a flood region. And finally, strategic considerations are ideas that we would like to share to always keep in mind. Try to always have a risk management principle and apply them to a broader supply chain management risk plan. And also think about it during your preparedness phase. The second strategic consideration is during the preparedness phase, to better respond to crisis, include risk management approaches to protect information systems, because there are examples where countries due to war have completely lost their supply chain data. So why don't we try to improve the protection of that data during the preparedness phase? And emphasize the various roles of the supply chain management team to assign very concrete roles in how to deal collectively with the risk and the threats that might affect your supply chain management. So I thank you, and I will pass the floor to Nora.
Thank you, Annabella, and thank you for reminding us of the key elements of risk management and how important it is to have a risk management plan in place to mitigate risks and the unpredictable events sometimes, as you said, that happen all of a sudden, and it's very important to have a risk management in place to reduce those risks. So before I pass the floor to Aya, we would like to ask you another and the last question on Menti. And for those of you, the Menti code is at the top of the screen. So just picture this situation, that the pre-clearance process documents are not received in time to clear the shipment. So think about one suggestion or action that you would implement in order to manage this supply chain risk. How would you mitigate it in real life? And I bet you have had this situation before in your working environment. So go ahead and think about what action you can take in order to manage this supply chain risk. Okay, keep an extra security stock. Yes, a buffer stock. Early planning, engage government authorities ahead of time in order to process the custom clearance as soon as possible. Local procurement, of course, an option always. You know, if you have delays in importation, having an option in the local market, it's always a good option. The green light release of shipment from origin. Okay, only after the broker has all the documents. Well, that might still delay the importation process, but you know, if you have a clear understanding of what the process is, that might help. Asking for documents as soon as procurement starts, of course. Yes, that, you know, that should be the practice there. Always to have a buffer stock, increase the buffer levels, use bonded storage to avoid charges while clearance is completed, advocacy with local authorities. but making sure that you have all the documents in time, okay? But when you don't, there are certain measures that you can take, like having a buffer stock, having a local procurement as an option, and so on. Okay, so thank you. So this give us, set the stage for Aya to share the experience in Libya by having a risk management plan in place. So without any further ado, Aya, I'll pass the floor to you.
Thanks, Nora. So starting with risk management, continuing where Nora and Annabella are saying, risk management is very crucial at any project, especially projects that providing health or medical services. So yeah, we have to be focused on the risk management plan as a formal and plan in place. So, slide please, yes. So first of all, Libya country is located in North Africa, as can be seen here in this map. And it has been in a civil war since 2011. The country is unstable until now. So IRC started its activity in 2016 by providing the high quality health services. And now it reached to it started with one office, and now it reached to 4 offices all over the country. So this is a quick brief for the activities of IRC. So the main office located in Tripoli, that providing primary healthcare, direct services and health strengthening services. So we have like 8 points, that 8 PHCs, primary healthcare, that providing both the strengthening and direct services. And in addition to the RAS team, which providing 24 hours, 7 days a week services. We expand our activities into the east, specifically in Shafat, as you can see here in red, providing a health strengthening program to 5 PHCs, as can be seen here. In addition to the south, as we are providing 5 primary healthcare services with health strengthening program. So this is a quick review of the location. In addition to the instability of the country, Libya considering as a passing point to Europe, so it's receiving thousands of asylum seekers and refugees yearly. This is, you know, providing health services to people in need, especially the health and medical care services. Next slide, please. So yes, as an organization that providing healthcare aid, IRC has its own essential drug list that is a whole comprehensive, including medications like communicable diseases, non-communicable diseases, in addition to the psychotropic medication. So the risk management plan is crucial to minimize and mitigate any disruption, as we said, in the availability of the medical and health commodities in general, to be available, you know, on time, avoiding any, you know, complications. So it's better to be prepared and having your plans ready ahead of time to increase your performance and get all the objectives done on time. So yes, next slide, please. So here we are asking why risk management. We're saying it's crucial and it's fundamental at any program. So in our case, in Libya country program, we're facing many risks. For example, first, the main one actually, the international importation. So the international importation due to the instability of the country and the variation, in the National Regulatory Authority, it's unclear. So sometimes we have suspending the international importation, for all NGOs in the country, which put a burden on the supply chain team to get the final release and the clearance. Sometimes we cannot, ask for the order, at the first place. All of this can lead you to more, risk in prolonged lead time. As you know, prolonged lead time is the main challenge. I believe maybe many of you have been through this. So very long lead time will, put real consequences. And as we're talking about pharmaceutical that is giving the shelf life risk or threat, as some pharmaceutical reaching the seaport as a nearly expired items, which is very critical, as it's not ending by receiving these pharmaceuticals to you. You still need to store these pharmaceutical, you still need to distribute, and then to reach to the end user. So you have to get the timeline, to have the longer shelf life put in ahead, and that to avoid any nearly expired items, and then resulting in expired items accumulation, high cost to do the disposal and so on. So if you have this risk management in place at the first place, so you will be prepared from these consequences. Other risks that might happen with us here, like budget realignment. Sometimes you having change in the budget and arises in new lines for procuring medical commodities, and as well this is be a real challenge for the supply chain team to work in a restricted time frame. So they have to be prepared. They should have all the backup, which is included in the risk management plan. On the other hand, the restriction in fund, sometimes you have an urgent procurement, but there is no fund. So even this one can be a threat, since you need your medical commodities and they cannot have them. All this can be covered in your risk management plan, and you will be prepared for anything else. Next slide, please. So first of all, if you would like to prepare your risk management plan, you have to do all the steps that mentioned here in this slide. First of all, you have to define the scope and context of the project to give the full picture. What is the risk actually gonna face in the future? You have to assess the likelihood of these risks. You can use the lesson learned from previous projects, along as with the collected data that you have, to be aware of what is the likelihood of this risk. Identifying the stakeholders, it's very crucial to have all the stakeholders should have an access to the risk management, especially among your team, like the program team, supply chain team, all should be involved in this risk management, as you need sometimes an approval or decision to be made from here or from this party or the other. It's very important to identify your stakeholders should be good. And then the priority of these risks. And this can be done by assessing the likelihood with the impact. So if you have high likelihood and a high impact, this is the high priority risk, which you should deal with it. And then you have to put all the recommendations, scenarios, alternatives that you have or you can do. And believe me, here you can add as much as you can. It's not for sure that you're going to use all these recommendations or solutions, but at least now you have a time to think and put everything written and in order, so it will save time in the future. So next slide please. Well, this is an example for a risk management plan in the IRC. As you can see, it's a formal plan that is containing, the key elements like the supply chain process and technical domain, the risk event that, mentioned the risk, and then the description of the risk. So here you can, put all the, the risk or threats that may take place and put it written in your risk management plan. In addition to this, the recommendation, solutions, action plan that can be taken. And here, as we said before, you can write everything, because you are planning ahead of time. So you have time to do everything, to use them on time. And then you have in red here the status where you can put all the updates that you have on hand. So, and as we said before, all of the team can have an access to this risk plan, so they can, understand where are we actually, specifically in the risk. Are we there yet, or actually we are avoiding this risk? So it's very important to having the risk management and be updated as well. Next slide, please. Where here is the risk that could happen in the health supply chain cycle. So here we can see a cycle of health supply chain. And this is, expected risk that could take place. And as we said, it's a cycle. So any risk can happen at any stage. It's going to be consequences on the next after. So it's going to be, affecting all over the cycle. So for instance, here we have the selection, which is the first step in the cycle. If some risk that could occur, like, picking medication that is not in the essential drug list, as we said, it will be going forward with the wrong, medication. So we have to be very, very accurate in selection items that we are procuring. The other step is quantification. So any, poor quantification resulting in an overstock or outstock. So according to the mistake, in the consumption data, as you know, using the consumption data to do the quantification process. So it's very crucial to be aware of the consumption data quantification tool that on hand. And next step is the procurement. So most of you are, understanding the prolonged lead time. Many of you have been through this before. So this is causing a delay in delivery and a major, problem in the future. So this is a kind of, risk that we can mitigate or minimize with the risk management plan. And then we have the reception, that receiving goods without following the SOP that we have. The risk in storage, for instance, that if you're receiving a pharma and you have a shortage in the storage capacity, now you have the pharma and the capacity is short, so it's a real situation here. So you need to do something. But if you are well prepared, you have your risk management plan, you have plan B, like another warehouse or something. So here is another risk that can be avoided by the risk management plan. The last two steps, which is distribution and the use, it's very important to have them, like a distribution of these pharma, for instance, cold chain without the data logger or unrefrigerated vehicles, it's going to be a serious, problem and regarding the quality assurance aspect. Also, the use of dispensing these pharma with poor, recording, and there is no tools for consumption. All this will lead you to this, risks, and then we go in this cycle as well. Yeah, next one, please. So here is some of the risks that or threats that can happen at any, medical, commodities, programs. So here's, first of all, is lack of competition in the local market. The registration of the local suppliers in Libya actually is happening by registration of the manufacturer. So each supplier has its own manufacturers, like 2 or 3. And any supplier cannot import, from other places, only these specific registered manufacturers. That lead us to less variety and sometimes less availability. So how can you avoid this, this threat or risk? You can increase the number of the pre-qualified suppliers. Also, you can collaborate with the other NGOs, in the country, as they may have solutions, recommendation from their side. Also increase, reliance on the international MPA with the support of the global supply chain team. So all this, it's an examples. It's examples for that solution or recommendation that can be taken. The other risk, as we said before, is poor consumption. Poor consumption data resulting in a poor quantification and misprocured quantities. I mean, overstock or outstock. So how can we avoid this, this risk? By following up on the average monthly consumption, following up on the drug management committee, assure all the requested items are accurately forecasted within the essential drug list. And we have the resources here like the IRC consumption tool, IRC quantification tool. We have also the PPE burn tool. All these tools, as a resources, we can use it to avoid the poor consumption data, make everything, accurate to avoid any overstock or outstock. Sometimes we're having quality assurance issues, like sometimes, for instance, we've been before receiving a cold chain items in unrefrigerated containers. So, to avoid this type of risk, you can have your buffer stock well maintained, enforce IRC quality assurance policy to ensure compliance with the good storage practice. Also, you can follow your procedure in recording this to the quality assurance team, to make the decision about this, and, contacting the vendor, asking for air shipping, for instance, to increase, to decrease actually the time, for shipping your shipments. So, yeah, all this risk could take place in your, supply chain cycle, and now you have it written, so it's easier, to mitigate these risks as you are well prepared for it in case it happens. Next slide, please. So during the COVID-19 pandemic, actually the IRC risk management plan helped us, in many ways. Despite we did a lot of orientation amendment, I believe that happened everywhere, as we faced new things that we've never been before, and risk is coming up every day. Sometimes curfew, sometimes many things that happened in a short time. So yeah, you have to be prepared and updated your risk management plan accordingly. So IRC country program emergency response finally met all the requirements despite restriction and the impact of the pandemic. Updated detailed guidelines for the country medical commodities importation rule and regulation has been developed and put into action among all stakeholders. So as we said, it's very important to have an updated, it's not fixed, plan. You can make amendments, you can have all the recommendation, to add it to your risk management plan. Next slide, please. So here's examples for risk management plan during the COVID-19. Delay in procurement plan. Sometimes you have health commodities in the pipelines. So the pipelines are due to the restriction, shipping restriction that happened during the COVID-19. So to avoid this type of risks, have a reliable local supplier to avoid the consequences of the delay. Or you can deal with the vital drug list. For instance, you have a delayed shipment, and you have your valid vital drug list. So you will stick with the vital drug list. You can do it this urgent procurement locally, until the international shipment reach you. So this is a solution or specific action that can be done. Also assure a longer shelf life actually to the pharma that you requested in the first place. So take it longer as much you can. You can ask the supplier to take a longer shelf life to avoid, nearly expired items on hand and then delay. You can't expect actually all the time the delay in procurement. So here, the resources, you have the vital drug list ready. You can, do it like for 1 month or 2 months, for instance, to avoid the delay in the international procurement. So take your demand for 2 months from the local suppliers, make it, priority for your vital drug list. This is, some solutions that can be taken. It's different from one phase to another. All this can be made by, as we said before, assessing the risk that can happen, and then based on it, you can put these solutions. Sometimes funds are not available when needed. So I think this happened in the COVID-19 pandemic. So sometimes you need to procure personal protective equipment, the PPE, and it was a real demand in the globally in the global market. So sometimes also the prices were high and fluctuating from time to time. So sometimes you need it, and there's no fund for these types of procurement. So here, for instance, you can communicate with the stakeholder to find an urgent budget line or reallocation if needed. Evaluate the priority and try to explain the situation to the funder. Sometimes you need to use the consumption tool, so you can have an evidence to show it to the donor or your team management to make it clear for them how much you need these items. Or sometimes if you did all of this, you can go to readjust the procurement plan based on the available fund, and then you can prioritize. So this one is a high priority. I can do this, and then the others can be done later on if I have the proper fund. So next slide, please. Well, this is an example for one of the tools that we used during the COVID-19. This is PPE and integrated professional equipment calculator, and it's very helpful, to have your stock maintained. And we didn't face any stock out of the PPE during the pandemic. So this tool actually can be used so easily by putting the number of hospitals or isolation centers, and then adding the number of staff that you have on field. It will gives it gives you the alarm if you were going to be in a stock out in the next month or in the next 6 months. So it's very useful to have these tools on ground and to use them accurately. Yes, next slide. So as we said before, risk management plan, it's not fixed. So it's changing actually all the time, changing according to the situation. So it's not a guarantee like 100% you're going to use this plan. Sometimes you need to make amendment, make changes in a specific, specific part of the risk plan to, to reach your objective. So we can monitor and review our risk plan management. We can do a reliable reporting of solutions. As we said, it's written, so you will prepare for it. It's very important to report recommendation and solution. Feedback for the stakeholders, all of them should be on the same page, having all the info that they need in case, as we said, we need an approval or decision to be made quickly. At least they have the background, they understand everything that is happening actually. And then you have to monitor the key indicators throughout the process. It's very important to monitor the key indicator. As you can see, sometimes you can improve it. In the next year, it's going to be like covering 80% instead of 60%. So it's not fixed. You have to go through it with the monitoring of the key indicator to evaluate the process. And then the results analysis documentation of the lesson learned, which is very, very important to have these lesson learned documented, as you can use it as, data to prepare your next risk management in case of disaster that, happened, or another war that's taking place, for instance. So it's very important, to assess and monitor your risk management all the time. Thanks. I think I finished here. Thank you so much for your attendance and for your patience. Over to you, Nora.
Thank you, Aya. So, okay, we have some questions for you, Aya. And I think that some of the examples you gave are very pertinent to what the audience is asking. One of the questions is, what if what happens if the risk is political? And Annabella mentioned something about, the different, when you do a risk assessment, you also classify the risks, right? And you can decide whether to accept the risk, to avoid the risk, to reduce the risk, or to hedge the risk. So this person is asking, what if the risk is political? What would you do?
Well, I believe that we can reach to the authorities in case of the issues is going with the authorities or the national regulatory authority, trying to explain that we are providing a humanitarian aid. We actually doing good things by donating these pharma, for instance. Also, I believe that contacting other NGOs in the country, as to be a kind of like united let's say body for explaining this stuff. I believe it worked. Yes, I think it's gonna work if we try to explain and be visible more to the authorities.
Okay, thank you, Aya. Okay, there's another question. Have you been in a situation where your insurer declined coverage for risk associated with recurrent socio-political demonstrations in the country, for goods that are already in your warehouse? And if you have faced that situation, how did you mitigate it?
So the question is on, I believe, the storage.
Yeah, if the insurer did not provide coverage for some political demonstrations or civil unrest, and the goods were already in the warehouse, and I believe that probably you cannot distribute them. And how do you mitigate that risk?
If I understand this well, so the question about the the coverage, that's what you need actually to get the goods, right?
Yeah.
So yeah, this can be done during the analysis process. So you in the country and you understand the process, so you should be prepared for any documentation on hand. You can ask for it ahead of time. Do follow the procedure in the country as much as you can to be legally. So now you can minimize the risk of refusing these goods or pharma on hand.
Okay, thank you. And do you face any risks associated to the last mile distribution of commodities? For example, that there's a carjacking, a theft, and if so, how do you mitigate those situations?
Well, yes, I think that we've been through it, due to the instability of the country. So sometimes you do the distribution and you have like checkpoints that, asking for what is this actually and so on. So here you should be prepared, like having your old document, on hand. So no one can go with a pharma without any documentation. It's illegal. So you should have everything, recorded and documented. And follow the procedure, and most of the time it's gonna be safe, distributor safe, for medical communities.
Okay, thank you. Someone is asking if you have any quantification tools that you use, that IRC uses, and for which programs?
Well, actually, yes, we have the quantification tool, which is very, very accurate tool that you can, the thing is that you have the consumption data accurate here. So as we said, yeah, you have to be very careful at each step. You know, it's going to affect the step after this. So it's very important and very crucial to have the consumption data, sometimes demographic data that you need to put them in the quantification tool. And it can predict the lead time. You can put the, if it's local procurement, if it's international procurement, you can put the buffer stock as well. And it's a calculation. So it's very, very important to have, you know, quantification tool in place. And in many country programs, it reaches 100% accuracy. I mean, like the project is ending by, let's say, the expected, you know, stock, which is almost zero as planned. So very important using this source. Yeah.
Amazing.
We almost,
Okay. Okay, so there's another question related to what could you do if all HF have the same challenge of overstocking the same items?
well, yes, we've been through this actually before, and the solution, or the, you know, the recommendation can be done is to assess the consumption, and then, you know, you can subtract the consumption, then taking the estimation that of the overstock and redistribute them. You can contact other health facilities, you can make donations, and it's very important to do it, you know, ahead of time to avoid the nearly expired items. Believe me, dealing with the nearly expired items is a real challenge. So you have to be prepared, and especially with the pharma. So, you know, time goes very fast, and you should be prepared with, you know, everything, forecasting, consumption tools, everything should be in place to avoid this, you know, integrated.
Great. And someone is asking if there's any app used or suggested by USAID. And I don't know if you know any application that can be used for risk management in particular.
Well, actually, no. No, I've never seen an application, I mean, for this. Well, here in IRC, we have it a formal, I mean, for each country program. And, but it's, you know, a tool, not actually app.
Yeah, we'll try to find out if there is.
Yeah, maybe.
We'll try to respond to this. Okay, so thank you so much, Aya, for those questions that we didn't have time to answer live. We will get back to you with the help of Aya. We will address them and send them to you all for your information. So before we come to the end of this webinar, I would like to share some ideas for action. You know, just to remind you that to include the risk management principles and apply them to supply chain management of health products as part of the preparedness phase. It's very important to ensure that any risk management plan has to be done in the preparedness phase, so that when a crisis hits, you already have a risk management plan in place. Also, once you identify risks, you have to categorize the risk levels based on its impact. You know, whether it's, as we say, something that you can manage, that you can avoid, and that you can reduce the risk, etc. For example, where we're talking about labor issues, strikes, demonstrations, political unrest, restrictions in importation, poor quality problems with the products, cash flow problems, and I think Aya mentioned the need to have budgets in place that will allow you to react or to respond to a risk and mitigate the risk of not having enough funds to procure products in the local market if you have problems with importation. So it's also very important to form a team, as multidisciplinary as possible, including, of course, the financial managers, to analyze the risk and the solutions within the organization's control, those risks that you can manage, especially those related to funding gaps or delays, having enough buffer stocks to mitigate the risk. It's also a very important action that you can take. And just to remind you about the resources, you know, for those currently working on a risk management plan, we invite you to look at these resources that you see on the screen, and especially the risk management plan, how to develop one, and also the case examples, the workshop materials, and the decision support tool. All these tools and resources will be very, very useful for those who are really trying to put a risk management plan in place. And of course, you always have Aya here available to help you in case you need some guidance on how to put together a risk management plan, because she has been able to develop and implement one in her organization as part of the teamwork. So thank you, Aya, again, for sharing your experience and for being available to the rest of the participants who have joined us today. So with this, we thank you again for joining us today, and we hope to see you in our last webinar this year, which will take place on December 17th, if I remember correctly, but we will confirm. 18th, right, Annabella? 15th, sorry. So yeah, we hope to see you then with us again. So for now, see you next time, and
thank you.
Have a good day.
Thank you, everyone.
Thank you, Aya, again.
Thank you. Appreciate it. Bye. Bye.
Take care. Bye-bye.
Bye.